Unions representing over 1 million nurses and other NHS staff have written to the Chancellor demanding a pay increase. These demands come in the same week as ministers scrap the 1% pay cap on police and prison officers. So there's a lot moving now. The unions want a 3.9% pay rise and to receive an additional payment of £800 in cash. Their demands for the extra 800 are a bit like saying we want compensation for 7 years of austerity. That's how it's being described, during which time they say NHS wages fell by 15% in real terms. The increase would add an extra £3 billion to the NHS pay bill. The unions argue that keeping NHS pay frozen has contributed to the service's workforce shortages and has pushed staff to the limit. There's been huge public support for nurses in the last few years. Many people will think that NHS staff fully deserve this pay increase, but to go straight from 1% to 4% with a bonus of £800 may irk others, especially those in the private sector who've struggled in the last 7 years. So what are the rights and wrongs here? Let's discuss it. 08000 288 291 is the number. Email us vine@bbc.co.uk. We're joined by Sarah Gorton, who's head of health at Unison, the trade union, and also by Jonathan Davis, an economist and wealth advisor who's in Dunstable. Sarah Gorton, first of all, can you explain why this is necessary?
Good morning. So last year, the independent pay review body called on all parties to get together and agree an exit strategy from pay restraint. They accepted that there was a need to avert a crisis rather than just wait and pick up the pieces afterwards. So what we're doing is getting ahead of the curve, and we are submitting our request to the Chancellor ahead of the budget so that the NHS can plan for a decent pay rise next year and get us out of that austerity. We're not the only people pointing out the impact that successive years of pay restraint has had on the NHS. This is our plan for coming out of pay restraint.
And the signal from the government is pretty clear, because they basically said ministers get flexibility on pay. It doesn't have to stay at 1%. Police officers are getting 1% plus a 1% bonus. Prison officers are getting 1.7. So you want to get nurses and other NHS staff in that queue, is that right?
Well, the pay review body reports that were out this week are for this year. What we're talking about is the pay rise that would apply from April next year. So it's the next pay round we're talking about. So we're getting in early, in time to influence the planning of the budget. So what we want to see, and the most important factor, is that there is money provided in the budget. So doing what's been done with the police and other groups recently, of just passing the responsibility for finding that money down to the individual organisations, just won't work. So if the NHS is going to have a pay rise, it has to be properly funded and new money found in the budget. We think the public will support that. We're going to put lots of effort into trying to demonstrate that and to test that out. And
so when you say test that out, indeed, new money found in the budget, where are you going to look for it?
Well, it's up to the Chancellor to make sure that the budget matches the priorities of the electorate. And one of the clear messages that came out of the last election was that the government should prioritise the NHS. We're not the only people saying that they should be a priority. We intend to do lots of work over the coming months to prove that that's the case. And we look forward to talking to the government. And just as soon as they give the pay review body a remit and ask them to look at this, we want to provide them with detail of what we think the proper costs and benefits of this claim will be.
But you don't know where the money's going to come from?
Well, it's up to the Chancellor to find the money that's needed to properly fund the NHS.
But if you're asking for it, you must think it's available.
Well, we do think that there are ways that the government could cut its cloth differently, and we will be keen to put proper evidence into the pay review body when it's given a remit that shows what we think the benefits to the service could bring, the benefits that the NHS could reap from not having constant churn, and look at how the budget could be set and the advantages that could be in play from providing this money for a properly funded NHS.
OK, Jonathan Davis is listening, economist and wealth advisor. What do you think, Jonathan?
First of all, it seems to me the main financial problem of the NHS is the vast debt under the Private Finance Initiative that governments a couple ago put the NHS under. So, of course, the NHS is paying vast amounts of interest, so that's impacting their budgeting. The general issue that the public sector is hard done by. It just doesn't wash with me. You know, if they don't like the public sector, let them try working in the private sector where the pay and conditions is significantly harder. I can assure you that, particularly pensions. On top of that...
because the private sector employees are not exempt from the minimum wage, are they? So they would be, the lowest paid ones would be at roughly the same level, surely?
Yeah, I'm comparing public sector workers with the private sector workers. I'm not talking about like crooked bankers or whatever. In the private sector, the pensions have been absolutely slashed, if at all. I know lots of people who have not got any pension other than what they're putting in themselves. So, you know, I'm just saying, you know, there's a lot of complaints from the public sector. They're not hard done by compared to equivalent jobs in the private sector.
What about the idea, Jonathan, that the NHS is special? It's, as somebody said, it's the closest we've got now to a national religion, and they need nurses in particular need to be treated in a special way.
Well, of course, we've heard that forever. That is a political and perhaps moral decision. I personally don't take that view. As far as I'm concerned, they are providing a service, an excellent service, a most welcome service, but they should be paid for the job. And on the basis that, they have had, we have all had significant income tax cuts in the last several years. That, of course, has benefited their bottom line. On top of that, those who have had mortgages, mortgage rates plummeted several years ago, so that of course helped their bottom line as well. And in the NHS, people perhaps don't know this, although of course there has been the 1% per annum increase cap. In the NHS, you get points for every year of service. So actually, most folk in the NHS have not been capped to 1% per annum. So I just say that the public sector is not as hard done by as many people suggest.
Okay, Sarah Gorton, come back on that.
Okay, so for a start, we're not for a minute arguing that people who are working all across the public and private sector don't deserve a decent pay rise. That's not the case at all. Look, we get that most NHS staff work in their jobs because what they care about is improving the health and well-being of their patients, and that's their main motivation to work, not money. What we're saying is that sense of vocation has been taken advantage of. That's now having a direct impact on the NHS. It's good for all of us, for the NHS to have enough staff there and for them to be well motivated and feel valued.
Yeah, well, we're not back, with this, Theresa May's famous phrase that there is no magic money tree. You said you found some places where you can find the money for this pay, and I should have asked you what the places were,
well,
but I can't even imagine.
What we're saying is we want the Chancellor to make sure that the priorities of the electorate are matched in the budget. So it's not to me to write the budget. That's why Philip Hammond's in that job.
Well, now, hang on a minute. I mean, the priorities of the electorate are partly to pay less tax, surely.
Well, it depends, and one of the things that we're going to be doing is talking to the public about just how they feel about the NHS pay rise. So all of those issues will come into play. The other thing I would just mention is that another key argument is around cherry picking. So saying that one bit of the NHS is more deserving of a pay rise than another just doesn't wash with me, I'm afraid.
Okay.
I think the NHS is a team sport, and all staff deserve to be recognised.
Jonathan, Theresa May said there's no magic money tree. She then finds £1 billion to give to the DUP in Northern Ireland. So that blew that one up, didn't it?
Politicians will say whatever they need to say to get out of an argument. They can find money simply by printing it, which is what, unfortunately, central banks, the Bank of England, the Federal Reserve, the Bank of Japan, the ECB, you name it, they've been doing for years. And it's ugly to know that the central banks of the world are still printing $2,000 billion a year.
And yet we're seeing no inflation, which is always supposed to be the thing you get. So we're not Zimbabwe.
No, and we're not seeing inflation. Well, actually, we are. I'll come back to that in a second. We haven't seen inflation until last year for several years because all the money printing, all the quantitative easing that the central banks did, unfortunately, the wealth and the income went to the top 10%. So I'm not saying here that there is equality. On the contrary, there is vast inequality of both income and wealth. Thus, if the money went to the top, and let's face it, they're not the people who spend on the economy, that's why we haven't had inflation. But this is an important point. Inflation is coming back quite rapidly. This is the reason why the politicians are changing their tune. They're raising wages. This will further exacerbate inflation. Unfortunately, what this will mean is we'll get higher interest rates. The bottom 60% are still going to be in depression for many years.
Thank you very much, Jonathan Davis, economist and wealth advisor, and also Sarah Gorton, who's head of health at the trade union.